Before we begin, I want to share an important disclaimer. This episode of the Unapologetic Midlife podcast is presented for educational and informational purposes only. The content shared in this episode is not intended to diagnose, treat, cure, or prevent any medical or mental health condition, nor does it constitute medical advice, psychological treatment, or a therapeutic relationship. Any discussion of psychedelic-assisted therapy, ketamine therapy, or psychedelic substances is for educational and research-based conversation only. These treatments may not be legal, regulated, or accessible in all jurisdictions and are not appropriate for all individuals. The Unapologetic Midlife podcast and Midlife Media 716 LLC do not endorse, promote, or encourage the use of illegal substances. Listeners are strongly advised to follow all local, state, and federal laws and to pursue treatment only under the guidance of qualified, licensed healthcare professionals operating within legal and ethical frameworks. Views, experiences, and opinions expressed by the guest are their own and do not necessarily reflect those of the host, the podcast, or Midlife Media 716 LLC. Participation in this episode does not establish a therapist, client, physician, patient, or professional relationship between the host, guest, and listeners. If you are experiencing mental health distress, have a history of trauma, or considering any form of treatment discussed in this episode, please consult with your physician, licensed mental health provider, or qualified healthcare professional to determine what is appropriate for your individual needs. Listener discretion is advised. Thank you. Welcome to the Unapologetic Midlife podcast. I am your host, Mindy Labazetta, and I am here today with a special guest, Jenna Witkowski, licensed clinical social worker and psychedelic-assisted psychotherapist.
Yes. Thank you. Thank you, Mindy. Nice to be here.
Nice to have you. So today's episode is going to be about psychedelic therapies. And Jenna is trained in a whole variety of psychedelic modalities. And I know people are really excited to hear about this episode. I've gotten some good feedback already from people just mentioning that we were doing this. So we're just going to dive in. Let's have at it.
Yeah. Awesome. Yeah. I'm excited to be here and talk about this stuff. It's definitely become somewhat of a passion project over the last few years. So I'm happy to kind of see where our conversation leads today.
Yeah, me too. So let's just dive in. How do you even get started in doing psychedelic assisted psychotherapy? What does that look like?
Yeah. Well, I mean, if you're like me, you kind of accidentally stumble your way into it. I've had people ask me this question before, and what I've said is that I took an interest in this modality after, working as a trauma clinician for almost a decade. And I was finding that certain interventions, let's say, or modalities would kind of take people so far. And then there were some individuals that were feeling kind of like they were getting stuck. And I, like many people, read Michael Pollan's book several years ago, How to Change Your Mind. And it definitely was a strong influence in me deciding to, kind of look into these modalities a little bit more. And the trajectory that I took was, starting by looking at, different offerings and programs. I kind of like stumbled my way into this like right in 2020, actually. So as you remember, feels like so long ago, but not so long ago, like the entire world was kind of like falling apart.
Yep, definitely.
Yeah, I think one of the great things that came out of that, though, was that there were so many programs and things available online that otherwise may not have been. So I was able to kind of find my way to a program that was in its inception. And it was tailored specifically for folks like myself who were psychotherapists that were looking to explore this modality.
Yeah.
So that's kind of like how I got there. But and there's been so many things ever since. But
Yeah, and they're located at Fluence, right? They were located in New York City.
yeah, so the folks at Affluence were located downstate, and they had worked on clinical trials, for MAPS, and were kind of moving into the direction of providing education in this area. I think if I remember correctly, I was like one of the first applicants to their program. So
Wow.
it was kind of funny when I got there, like thinking about how far this field has come in such a short amount of time.
Yeah.
Pretty cool to kind of think about all the progress that's been made in the last handful of years in this space.
Yeah. So for folks out there who don't know what MAPS is, what is MAPS?
Yeah, so MAPS is an organization. The acronym stands for the Multidisciplinary Association for Psychedelic Studies. They were an organization that was founded actually in the 1980s, and they were part of a group that had started doing research with different psychedelic medicines. To attempt to bring some legitimacy to these modalities as healing modalities. So they were working specifically for a long time with MDMA, and they were conducting clinical research trials, with this specific medicine, and attempting to sort of do different studies to test with different populations of people, specifically to work with the treatment of PTSD. And they're definitely an organization. They're still doing different things and evolving, but they are kind of like a benchmark organization for psychedelic research.
Yeah. And is it fair to say that they're kind of paving the way for some of this? Isn't there been a lot of work in trying to legalize this stuff and get it back into researchers' hands? I feel like that's my knowledge of it, but you might know more.
Yeah, no, no, no. That's definitely how I understand it too. Is they were really, kind of working with these things, and also working on legislative efforts as well.
Hmm.
They kind of had their hands in so many different places, and a lot of their model has been around not only working with medicine itself, but also working with psychotherapists and other individuals who are providing different therapeutic support or components of support in that space as well. Because as you know, and as we often see, there's lots of ways to use psychedelics or take psychedelics, but in the way that maybe we work with it is bridging the medicine itself with the therapeutic goal as
Hmm.
well, and helping people kind of enhance some of their healing process.
Yeah. And I guess like when I think about psychedelics, I think of people needing options. Like you said, people not getting better. Antidepressants certainly have a place, but they're not going to be for everybody, I guess, to put it plainly.
Yeah, that's a great point. I kind of think of this point that there's nothing is really for everyone all the time.
Hmm.
It's really nice to be able to, as an individual, when you're going through something or you're going through treatment, to be able to make empowered choices about how you'd like your care to look, or what you might like to see in your own healing journey. I think about psychedelics as being tools. They're not the answer for
Hmm.
everything. They're also probably not for everyone. And just like anything else, I think that when we're looking at healing, I guess however we want to define that, we're looking at this, how I see it is a multifaceted approach. There's often many different components that we might be working with or somebody might be touching on as part of their process.
Hmm.
And for some people, psychedelics are a piece of that. And sometimes a really big piece or key piece in helping them feel like they're making some progress or kind of getting unstuck from where they may have felt like they've been kind of locked in for a bit.
Yeah, and trauma survivors, particularly, I feel like, or things like dysthymia or major depressive disorder, things where people are stuck and they're just not kind of getting over that hump or getting better. I know there's a bunch of research for even like alcohol use disorder. So when we're looking at addictions, like ketamine specifically, there's definitely a lot of research out there that supports helping people get sober.
Hmm.
Which is ironic, right? We're gonna use a drug essentially, right, to help somebody get better to stop using drugs.
Yeah, yeah, and there's this isn't kind of a, I guess, like a new thing. There are certain drugs that I guess we'll say more
Mhm.
for lack of better terms, like, or a better way of thinking about it maybe is like pharmaceutical drugs, right?
Yep.
Like we use certain pharmaceutical drugs even off label to help people with different things that they might be experiencing. Some of those sometimes are, substance use or whatever else. But yeah, I think that there's a lot of really cool stuff emerging, and there's a lot of applications of these things. And I guess the way that I've come to sort of see things, or and again, I'll preface this with saying this is sort of my spin on it, or understanding of it, is that as people we're dealing with lots of things all the time,
Hmm.
whether that's societally or we're dealing with things in our own individual lives. And, I've taken a big interest too in IFS therapy, and I think a
Hmm.
lot about like how we have these parts of ourselves that are trying to help us and trying to do that in ways sometimes that even can be somewhat maladaptive,
Hmm.
or ways that, in the moment are feel like a good fix. For some
Hmm.
people maybe that's drinking or
Hmm.
shopping or having
Yeah.
sex or doing whatever it is, right? Things that feel good in the moment. And sometimes it's interesting how it can kind of take us further away from our goal. So I think that, psychedelics can be a piece that help us kind of take a bit of a deep dive and a look into our deeper psyche, into our inner selves, and really helping restore some sense of wholeness in our system when we're feeling kind of fragmented at times in our society and culture even.
Yeah. If you don't mind sharing, how have some of your own therapeutic psychedelic experiences helped kind of shape you and your life? And I guess, like, how has that shaped you as a clinician who does this work as well? Because there's always that question, right? Have you done this? Is this something you would do? Right? People are very curious about that.
Yeah, I'm gonna be kind of playful with this for a
Okay.
second. I tell people all the time, most of my clients, not all of them, but maybe most of them probably assume that I've used psychedelics, and I've been pretty open about that. And my joke about it is that if I look back like 20 years ago when I was starting my career, if I ever thought I'd be talking about this or telling people like, yeah, I take drugs or do whatever, like I would have never saw this coming. So that's sort of the thing that sits with me sometimes is like how our lives take these different paths.
Yeah, very much.
Yeah, and yeah, I've admittedly, and I'm very open about this. I've used psychedelics as part of my own healing process. Kind of growing up, I definitely dealt with some different stuff that was challenging. Oh, and
Hmm.
there's a lot of different things that, kind of came up for me in childhood. Things related to attachment or things related to trauma. And much like some of the people I was working with when I got curious about psychedelics, I myself was also finding myself stuck in certain places.
Yep. Yeah.
So I kind of, started to get curious about these things as I was learning more. And I guess like one of the perks of working in this space is that you make lots of connections and you get to talk to lots of different people. And I've had a lot of really amazing opportunities to be able to use some of these medicines in a therapeutic way. So yeah, so I've kind of like ventured into the space of working with these things alongside a therapist, much like I do with other folks in my practice. And I've also done some venturing to other places, going on retreats that are structured, and
Hmm.
kind of diving into doing some group work in those spaces. And I'll tell you, every single one has yielded something so valuable and different, and some of them have also been really challenging.
Yeah.
But it's all been really part of, I guess, the bigger piece of kind of learning more about myself and learning more about how these different things can also work. And one of the things that I really value about having some personal experience is that I feel like if I'm going to talk to somebody or work with somebody in some capacity, I kind of like to know how it is
Hmm.
so
Yeah.
I can, better support someone, or I can better maybe understand, not to know exactly what that person's experience will be, but like kind of what is the signature of this medicine? What might it feel like what might this person encounter? I feel like it gives me an ability to be able to explain it more to somebody else.
Yeah, yeah, I feel like that experience, like, I'm pretty open with clients. I did an experiential, with you, with other clinicians, and it was really powerful, and I have to say that, I've done like EMDR, I've done my own therapy, but that weekend was just really, really a cool experience. And I think there's so much insight that comes with that to share with that to clients that if I didn't do that weekend, I wouldn't have had that, right? I mean, yes, I've been through trainings as well, but not like that. And you're more versed because you also trained with MAPS, you did Fluent, and you've done a bunch of different trainings as well. So,
Yeah. Well, I think it's like really wonderful too that you're kind of sharing with the folks you work with about some of your experiences. I think like every time that there's been an opportunity for that, because I also don't want to give the impression I'm walking around just telling
of
everybody
course.
off the cuff, like, oh, I'm taking a second.
No, 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 no. This is,
Yeah.
I want to reiterate a therapeutic situation where, like you said, retreats. It's very structured. It's not just like you're like, oh, go out there and do drugs. No, it's meant to offer insight and help you, I don't know, kind of tackle things that maybe it's hard for each individual person to face, or, it's like the hard truths of sorts that you're kind of holding behind lock and key. It just has a way of like kind of opening that up a little bit.
Definitely. And I think the point that I like to make with people, and I'm sure you do the same thing in your work with folks, is like the intentionality of it.
Yeah.
This
Why are
isn't
you?
just
Yeah.
Yeah, this is just like, "Hey, I'm, bored this weekend and I'm gonna take a large amount of these psychedelics," and I certainly too, I don't wanna knock the fact that I believe that there's a place for, I guess, like, unstructured time, joy, connection, right? Like, we can
Hmm.
use these things in lots of different ways. I guess for the sake of how we're speaking about it, though, is being thoughtful, being intentional, like, doing
Hmm.
these things as part of a larger process. And, yeah, that's certainly been, part of what I've done in some of the work that I've been kind of doing even personally. I just attended a retreat in Vancouver a few weeks ago that was really deeply meaningful for me.
I'm excited to hear about that one. I haven't heard about it yet.
Yeah, yeah, and I can just share you a little brief
Yeah.
blurb with you if that's okay to
Sure.
do
Yeah.
here. Yeah, so I found out about this organization in Vancouver that does work with 5-MeO DMT. So I've been curious about 5-MeO DMT, and for people who don't know about what 5-MeO DMT is, they kind of like refer it. People refer to it as kind of like the Mount Everest of psychedelics. That sounds really
It's like
intimidating.
yep, yes, very much. And you, if you don't mind me saying, you have done ayahuasca. You did an ayahuasca retreat in Costa Rica as well. So when we're comparing this to say, ayahuasca, ketamine, like just this is like the top of the tier.
Yeah, some people will say that they feel like it's that way, and the reason for that is that it's often like a very rapid onset of a medicine experience, and it's also a very large disconnection from reality as we know it. So there's not a lot of like for some people, including myself in my high dose experience, I kind of like had what folks will call like ego dissolution. So there wasn't really sense of like who I was or where I was at the
Mm-hmm.
time. So, sometimes when we're working with other medicines, we kind of like keep our ego intact, or there's more of a narrative story, or we have a sense of sort of being where we are in a room or in space or in time. And
Mm-hmm.
in this experience, it was a much deeper kind of step away from that. And to give some context, the reason I had decided to go on this retreat this year was, I lost my dad a few months ago, and I was
Mm-hmm.
kind of like processing through a lot of grief this year. And it's just been kind of like a period of transition and change. And somebody said to me jokingly recently, they're kind of like, well, when that happens, I guess you go and you have one of these experiences, and I would never think of doing that. But that's sort of where I've landed.
The spiritual, I think of like eat, pray, love, and psychedelics is part of the pray factor, right? It's connecting to that spirituality and whatever that meaning is going to be for you.
Definitely, definitely, and that's very much what it felt like. It felt like a very spiritual experience. It felt, in some ways, even though it seems like the antithesis of what I'm saying, it felt very grounding.
Yeah.
It very much like I kind of came back to myself, and it was really beautiful. And it was
Yeah.
another kind of glimpse into using some of these modalities or medicines for deeper healing work with folks too.
Yeah. Yeah. That it's so powerful. And I think in a world where, again, going back to COVID, where there was so much disconnection and isolation, I think people are still struggling with that. I think we have not fully recovered from that. I think the world is still divided and kind of a mess. I don't know if COVID was the launch pad, but that's what I kind of feel like just for more recent times that it was. So I don't know, something that brings healing and connection and just brings you, I don't know. I guess, like, I think of too when you said, "Bring me back to myself." I mean, does it help with anxiety? Does it help with that? Because I have heard about other psychedelics, they do kinda take away that anxiety and you just feel free and, like, not attached, right? When you think of ego disillusion, to me, that's that you're not attached to things or ways of being per se. Does that make sense?
Yeah, no, I think you're yeah, definitely how I kind of experienced it or understood it in the space that I was having the experience was that, I guess if we think of our ego, we think of it as a way of our psyche,
Mhm.
kind of protecting us, right? It's kind of
Mhm.
the thing that can like tell us stories about things, or it kind of can put guardrails or parameters around, how we interact in the world or how we view
Mhm.
ourselves, how we see other people. And we certainly are very familiar with people maybe that we come in contact with where we'll say, oh, that person's got a really big ego, right? Like, so we we throw that around and we'll say, there's a lot of that person, they take up a lot of space,
Yep.
what else. And when there's ego dissolution, and I'm not going to probably explain this correctly. I'm
It's
sure there'll be
okay.
someone out there
Yeah.
that will, tell me that's not the right.
Criticize.
Um, but how I experienced it was the stories that I was attached to and the little voice in my head that's there like all the time
Mhm.
was
Yep.
just like gone and quiet.
Yeah.
So it was just me. It was
Yep.
it was just my energy. It was just a feeling of being connected to something greater than myself, whatever we want to
Yep.
call that.
Yep.
It was a feeling of, I guess, like unity with everything,
The earth, the world, those around you, just the
everything.
noticing the
Yeah.
littlest of things. I always use that tree analogy down my street of, oh my God, all these pine trees are a different color. And I'd gone by them 100 times prior. It's those little things that just kind of hit you that have always been there, but you just didn't know how to see them, I guess. It just kind of paves the way for that.
Yeah, and what happens, I feel like, or at least what happened for me in this experience was once all that stuff was like not there, and of course, like yes, I after I had the experience, I come back online and those things start to kind of come back
Uh-huh.
in. Or I now have a blueprint, and a reference point for what it felt like to not have them.
Mhm.
And the biggest thing that I can name that felt different for me was I felt like there was this spaciousness in my body. And there was just kind of quiet in my head. And it was just like, I was just in the moment, to your
Mhm.
point, and how I hear that is sort of like this mindfulness, like being really present where you are and seeing things for the first time or recognizing things that you might not otherwise, because otherwise, when we're distracted or we're thinking about things or we're worrying about the future or dreading
Yep.
the past, we're not really here in the
Of
now
course. Yep.
either.
Yep. Yeah, we're not. We're
Yeah.
not. So it has a way of just bringing you back to the here and now. And I feel
Right.
like almost like kind of showing you what's important, right? Because yesterday is done. The future's not here yet. Like we literally only have today in this moment right now. And that's it.
Yeah, yeah, definitely. And the other thing that really stood out to me too, and I hear this from folks, all the time too, when we're working with psychedelics and in, therapeutic practice or other spaces, is that sometimes there's this thing we find out in life that like when we're in the throes of stuff, like everything feels like it matters so much. And it's true. Like we have problems, we have people we love, we have obligations, we get up every day, we go to work, or we, have duties or tasks that we attend to that are important to us.
Yep.
And then when we kind of strip all that stuff away, paradoxically, nothing matters, and we're
Right.
all kind of going to the same place, and eventually, we're all going to get older and die. I'm gonna say that here just bluntly, but like we're
Yeah.
not going to be here at some point, and everything that we've worked so hard for just kind of won't matter in the same way it does now.
It
So
is interesting. And I don't know if this work just has the ability to just kind of get you to think in ways that you don't normally think. A lot of people, they don't want to think about dying or coming to an end. But the reality is not thinking about it isn't going to prevent it from happening. I mean, think about my grandmothers that have passed, or eventually someday our parents will pass, and we're holding on to their memories. But once we're gone, like their memories kind of disappears, right? Like unless they I don't know, did something great like that left a mark on the world and some, whether they built something or created something that's going to withstand time, our memory, it dissipates. And it's kind of wild to think about that. So all this work that we do in this lifetime and everything we do, it's a little speck in the grand scheme of things.
totally, yeah. And I one of the things I think about too, and this is kind of another paradoxical thing when I talk to people about like death, because a lot of
Mhm.
times in this space with psychedelics or not, the concept of grief comes up, and I think we think of grief as in like the physical loss of someone or something. But I also think about grief in so many different ways. Like grief can be anticipatory, grief
Mhm.
can be over, what we call disenfranchised grief, which is not
Mhm.
things we typically think about
Yep.
grieving. But when we can hold the paradox of like the fact that death is going to happen, it almost like allows us to live more fully because it's
Yep.
a reminder,
Yep.
like each second counts, each interaction counts, our relationships do matter.
Yes.
And like we said, in the end, they kind not that they don't, because I think there's so many ways that we can preserve legacy and we
Of
can,
course.
preserve love and memories of folks, even just thinking about like making a recipe that a loved one made,
It
that's going
passes down through the generations, right?
totally.
Yeah. Yeah.
Absolutely.
Yeah. It's wild to kind of wrap your head around. I think too, most people are not going through life facing, people know I've had cancer twice, like I've faced my mortality. When you go through those experiences, you're forced to kind of re-examine your life, what's important, what you want your life to look like. I live very differently now than I did before I got sick. And as I've gotten older, like I've had to switch gears. I don't really drink anymore. There's things that I've just like they don't serve me anymore and I'm like, I'm good.
Mhm.
I don't know. It's interesting. It's such amazing work. So for people out there who are like, how does a therapist even get into this, right? For other therapists, what does that look like? Because I feel like going into this work too, it's like, okay, I'm going to go through this training, but am I going to be ready? Like,
Yeah.
one framework, so to
Mhm.
speak, of how this works. It's not like doing EMDR and I'm going to do this Francine Shapiro like EMDR protocol. It's very different.
Yeah, that's yeah, absolutely. And I'm glad that you're asking this question. And what I would say is the first thing is just being curious about something, right? Like kind of asking questions. Kind of what I did early on was when I started going through training and working with some of these things, I started to just kind of like reach out to other people that I knew were doing the work too. So
Okay.
having community, I feel like, is super important. So
Yeah.
whether that's attending a local psychedelic society chapter meeting or reaching out to another therapist who's already doing work. I will kind of open an invitation here that if there's anybody who's listening to this who's like, "Hey, I'm curious about this. You're welcome to reach out to me,
Hmm.
and I'm happy to share some information." And then I would say to your point, like, yeah, the thing is like a lot of this modality is kind of like in flux. It's dynamic. You can kind of make it what you want to make it. Like there's definitely training programs that will give you a solid structure and theory and kind of practicality around working with some of the medicines.
Okay.
And also some of it is, through kind of having to like bring your own style into it. So that's also kind of fun. I
Hmm.
really appreciate that part that, for example, if you're somebody who's coming from a certain cultural background and you
Hmm.
want to, add in different things or make ceremony out of something that feels important to you, you can do that. You
Hmm.
can make it what you want to make it.
Yep.
You can honor, what folks coming in, seeking services from you are also looking for and saying, how do we create ritual around this? How do we create a space that feels like it kind of opens up a place, a path of healing. So yeah, there's a lot of really reputable. Excuse me. I'll kind of put like a little plug in here. In February, Dr. Greg Lowen
Yes.
and I are running an introduction to ketamine-assisted psychotherapy training.
Perfect.
It's a little bit of a passion project for us. We've kind of, wanted to, help other clinicians kind of get footing, get started. And this would be a great way for folks to get kind of a finger on the pulse of what that work might look like.
Yeah.
And we're planning on kind of extending it into like a bit of a part two, kind of like we did maybe when you came through, of doing
Hmm.
some experiential work too. So that will also be an opportunity.
Great.
There's lots of really wonderful programs out there. So if ketamine is really not your thing, or you're thinking about, I want to work with psilocybin or I want to work with MDMA, I'd be happy to make suggestions, and or
Hmm.
even nowadays doing a real quick Google search or something else can yield
Lot
so many
pops up.
results.
Yeah.
So
Yeah.
much stuff.
Yeah, and I'll definitely post, obviously, your website and your information, your contact information in the show description, so people, if they're trying to get a hold of you or have questions or want to work with you, they can find you. Tell me a little bit about the not for profit that you and Dr. Lowen started.
Yeah, so Dr. Lowen and I started a not-for-profit called the Center for Healing Intelligence. We call it CHI for short. We had this idea about wanting to allow expanded access and accessibility for folks of all different backgrounds to have the ability to access these medicines. We also are looking at part of what we're doing with the educational piece of things too is kind of another arm of chi. We really wanted to be able to think about educating not only folks in the community but other clinicians who might be doing the work. And we're also kind of working a little bit with research as well. So we're doing that right
Yeah.
now via Roswell Park. But we kind of had this idea of this organization that would allow some access to all those things for folks, and kind of making it a credible source place for people to go. What I can say about it is we're still in our infancy. We're still kind of
Hmm.
building. We just expanded our board a handful of months ago. We're having a lot of exciting discussions, and our primary goal right now is fundraising. We want to be able to sponsor ketamine scholarships for at least 5 participants in
Wow,
full so that
that's
they
great.
can have access. Yeah. So what we know about these modalities is they're pretty pricey.
Yeah. I mean, there's options, right? I mean, especially when we're looking at like ketamine, people have options. What are the modalities for ketamine? A lot of people don't know any of this.
Yeah, yeah. So there's a few different things. So there's a pharmaceutical version of ketamine that's called Spravato, which is a nasal spray for
Hmm.
some people that can be covered by insurance. There's a bit of inclusionary and exclusionary criteria around that, but that's available here locally. I believe like Landmark Health and Dent are offering that currently, and I'm sure some
Great.
other places are too.
Yep.
There's IV ketamine, which is offered by a few places as well. I know like Dr. Kaplan is doing that, and Dent is also offering that. Dr. Lowen and I and many other people, many other clinicians, like yourself and
Hmm.
others are working with oral ketamine and also intermuscular injections of ketamine. What we do is, called CAP, ketamine-assisted psychotherapy. So there's not just sort of an administration of the medicine, there's a psychotherapy component that goes along with it.
Which is
Uh,
very important.
yeah, yeah, I like to think so, and research says that it is too. If we look
Yep.
at it, that outcomes and people's results kind of over time tend to yield more positive results and better outcomes by having the psychotherapy as part of the component of treatment as well.
Yeah, when I think of ketamine, people have a lot of questions before. Let's talk a little bit about set and setting when somebody is going to have a ketamine session.
Yeah. So set and setting are terms that were coined, in some of the psychedelic research that is being done for a very long time now. And set refers to your mindset going into the experience. When we start working with an individual who's going to embark on a psychedelic experience, part of that is, what we call preparation, so
Hmm.
that could look like history taking with a person, that can look like, a medical screening, which, is always done for safety and efficacy.
By a medical doctor.
Yes, exactly. Yes,
Hmm.
yeah. Somebody who's licensed enough to prescribe the medication in a safe way to people.
Hmm. Hmm.
And also too, just starting to explore what someone's intentions are. Why are they saying yes to this thing? What are they hoping it will help with? And also creating a nice pathway to a healing experience. So that can look like kind of examining what kind of beliefs are we bringing into this? How are we kind of coping with our day-to-day life right now? How can we create like the best environment for the most healing to take place, our mind frame around that and the questions we're asking ourselves and how we're talking to ourselves about that is very important.
Yeah.
Yeah, and the setting piece is kind of what it sounds like. It's like, where does this experience take place?
Yes.
And I think that's one of the really cool things about CAP is that these experiences are taking place in comfortable environments. They're taking place in a space that hopefully is like safe enough for somebody to do deep healing work.
Hmm.
They're being attended by somebody who's going to hold the space for them and also
Hmm.
make sure that they're safe throughout the process.
Yep.
And when we have those things together, we have a really nice recipe for a really deep, profound medicine experience when somebody is feeling kind of at ease or prepared in both of those places.
Yeah. I mean, this is very, I don't want to say fragile work, but when you're taking somebody into, say, a ketamine experience, right? Our job is to hold space for them. It's to be there for them. And how might this kind of therapy, like if you're in session with a person, look different than say traditional therapy?
Yeah, so this therapy looks quite different than traditional therapy.
Which is always interesting, and we have to have those conversations, right?
Yeah, yeah, definitely. And I would say the biggest thing is that, first and foremost, the sessions are much longer than traditional therapy. So when I'm seeing somebody for ketamine sessions, I'm with them for about 3 hours. So that includes some time to kind of like bring them in, get them set up, getting them ready. That's not the entire duration of the medicine experience, but during that time, we're kind of clarifying intentions or getting somebody ready for the experience. The doctor might be checking vitals. Like we're doing all these
Mhm.
things to kind of ensure that the person's ready to go. So they have their medicine experience and we start kind of the therapy right away. But those sessions are much longer.
Yeah.
The other thing that's really different about them is that sometimes there's not the same type of like back and forth that might be in a normal therapy session. A bit, and this depends on dosage and kind of how we're working with the ketamine, but sometimes people are journeying pretty deep,
Mhm.
and the therapist's role in that circumstance is to hold the space for the person. And what I
Mhm.
mean is that you're there and it's in and you're attentively, feeling into the person's energy and you're maybe discussing ways that the person can signal to you if they feel like they need assistance with something. We're doing everything. One of my favorite parts of doing CAP work is being what I call a psychedelic DJ. We use music as part of the process.
Yes, the
So
music. Oh my gosh. Yeah. I feel
yeah,
like we could have a whole session on the music.
there's music as part of it. There's ceremony, there's ritual. And the other thing that's also present sometimes in these sessions that's really different sometimes from psychotherapy is that there's even an element sometimes of like therapeutic touch.
Hmm.
And this is, and I preface this by saying this is consensual. It's
Yeah.
discussed ahead of time.
Yes.
It's never sexual. It might be a handhold or some other supportive way of providing support to somebody who's journeying in an altered state of consciousness. All these things are a little bit of a different vibe,
Way
from regular
different.
therapy.
Yeah. I mean, we weren't, I know our schooling wasn't too far away from each other's timeline. And it was very much about like, don't tell me any part of yourself. I remember once interviewing for a job where a woman was, how many of your clients know that you've had cancer? And I'm like, well, my face is hanging on a billboard at the Ride for Roswell right now. So, probably anybody who's involved in that is going to see it. And she's like, none of my clients know anything about me. And I'm just like, I'm never working for this lady. Like,
Mm,
and I feel like it like puts a person on a pedestal. And I feel like doing psychedelic work and even like therapy today, because I think it's evolved, right, for the times. COVID did that for us, right? You got a kid screaming and, I got to go to the bathroom from the other room or, crazy stuff going on, which didn't happen prior to COVID, right? There was no mix of anything personal. But I
mhm,
think COVID kind of pulled back the curtains a little bit and allowed us to be people as well, because we
mhm,
were going through that very same experience. But what I love about the psychedelic work is that it is a little bit about connection. People want to hear about our experiences or, they want to kind of better understand. And I think that's another really important component of psychedelic work is the therapeutic alliance. Like
mhm.
you have to have a good relationship with your therapist.
Definitely. Yeah. And to everything you said, yeah, I feel that so much. I was just watching, I love the show Couples Therapy.
Ooh, I
And
haven't watched that.
I plug this show all the time. I was watching an episode a little while ago that like kind of was filmed during the pandemic. And I
Okay.
had like, there was a scene in which the therapist is like on Zoom and she's having trouble connecting with the people. And I had this like gut feeling of just like, oh, I don't miss those times. And how I kind of joked to myself that I was like, I'm not going to see anybody online. And then after like, 2, 3 weeks, I was like, I have to see people online.
Right. We just got to suck it up and figure it out. And here we are. Yep.
Right, right. And yeah, I think the human element of things is so important. You're right. Thinking back to like when we're going through school or training, so much has evolved and changed over time.
Yep.
And I think the thing is like, there's obviously like appropriate things to bring into
Of
therapeutic
course.
space and some things that, we don't. And there's definitely what I'm aware of very clearly all the time in the therapeutic space is that there's a power differential that exists. And
Absolutely.
when somebody's in an altered state, it's even more so. With greater, let's say, power, for lack of better ways of putting it, comes responsibility as a clinician, right?
Absolutely.
To
Yeah. When you
create,
do this work, you ethically
yeah,
need to stay on top of doing the right thing. Like it's very important because somebody's trusting you while they're in a very vulnerable state.
yeah, right. And the way I kind of put it is that you better know what your own shit is, because
Absolutely.
it's gonna come out whether it's consciously or subconsciously. And in these spaces, I feel like there's such an amplification of transference and countertransference and energy that happens in these places. And
Hmm.
that can create such a beautiful opening for healing. And it also could create a place that could be very potentially damaging to somebody if somebody's not doing this work in alignment. What I'll tell people, whether I'm doing consultation or I'm doing supervision or whatever else, is just kind of like, take care of you too.
Absolutely.
Yeah,
Absolutely.
take care of you.
Yeah. Yeah, no, it's so important. I think too, what we do is work with clients through their trauma, right? We are experiencing vicarious trauma
Mhm.
every day in and out with the work that we do. And I will say with experience and our own personal journey of healing and like maybe working with a therapist ourselves. I know I have my own therapist.
Same.
And it's huge, right? Even though my own therapy is my own stuff, it's also helping me manage how I interact and how I show up for clients every day.
Yeah, when we're aware of our own stuff and we're working through it, we're less likely to like have it subconsciously enter the room with us. So, or we're more likely to be able to say, I had this come up last week in a session with a person I'm working with, and I'm sure they wouldn't mind me speaking about it in generalities here, but this is a person I've worked with for a long time. We were having a dialogue about a place in which I had made a misstep and said something that had hurt their feelings, and
Okay,
they were courageous enough to bring that to me and say,
good.
"Hey, I want to talk to you about this." And I
Yeah,
was like,
good.
okay, let's talk about it.
Yeah.
And I remember at some point in the discussion, I named to this person, I said, I just want to name something that's happening for me right now. I'm like having this feeling in my body and I'm noticing I'm feeling a little bit defensive about this.
Right.
And I
Which is a
named it.
human reaction.
Yeah, yeah, and they were like, "Thank you for naming that to me," and it really evoked this really beautiful conversation between us, that was, in some ways not at all scripted or planned, but it
Nope.
was so incredibly therapeutic, and I
For
think
for
also
both. Like, we learn from our clients too.
100% all the time, right? That's the thing. And there's just so much like, this is like the fun part of therapy is that there's just this kind of like unfolding process that happens. And like you said, if we're paying attention as we should be, we're learning so much from other people, whether it's about ourselves or about others. And it's just a really beautiful thing.
Yeah. Yeah, there's something really magical about doing this work, and I don't know. It makes me excited, just to be able to continue to do this is just really, really, really cool.
Yeah, it's a lot of fun.
It really is. I just wanted to ask a little bit more. You had mentioned the scholarship. Would that be for a person who's interested in taking therapy or for a clinician going into like training? What does that look like?
Yeah, so that's a great question. With the actual piece that I was talking about with the scholarship, what I was referring to is funds that are being raised to sponsor someone's ketamine treatment. So this
Okay.
would be something that would be given to an individual who is saying, I want to embark on this treatment, but I maybe don't have the financial means or access to be able to do that in a way that provides me access.
Okay.
But the other pieces too for the training is, I was really trying to think about, how to bring in folks from all over the place. So one of the things that I did when I was kind of structuring some of the models for this training that I was talking about earlier was, we do have like equity type offerings available for people. So
Hmm.
there's a reduced registration fee for that, which
Okay.
is kind of offered across the board. And if folks are interested, we really would love to have, a diverse group of people and backgrounds and kind of wisdom and knowledge coming into the space. So that's available for folks too. So that's, I guess, like
Great.
not quite a scholarship, but it's an offering that's there for folks if they'd like to take
Yeah.
advantage of it.
Yeah. If there's, a financial need, it's worth having a conversation, yourself and I haven't had Dr. Lowen on the show yet. I got to set up a date with him to do that. And he's a medical doctor who prescribes ketamine. So Dr. Lowen and yourself will be the ones running this training.
Yes. Yeah. And
Awesome.
that's bound to be a really wonderful conversation when you have him on here.
I'm excited. Yeah, yeah. I'm getting better at this because I'm new too, and lots of learning involved because this is a new beast. But it's a cool way, I think, to share more about what we do as therapists and have the conversations again, like we're having, obviously you're not my client, we're colleagues, but to have the conversations and get that out there further, that's kind of the goal of all this. And I really do believe in this work. And I know you mentioned you're doing a psilocybin clinical trials at Roswell. Can we hear a little bit more about that? Because, I think that's not legal, right, in New York State
Mhm.
at this time. I'm
Right.
not even sure where we stand in the legal process because I haven't looked recently, but, if you don't mind sharing a little more about that.
Yeah, sure. Oswald Park has been partnering with another organization called Reunion that is sponsoring clinical trials for individuals. They are running a clinical trial that is using a study drug. It's so funny because Greg and I are going through this right now, and how we talk about the stuff at the clinical trial is so different than how we do it in the therapy
Okay.
space.
Okay.
So much more regimented. It has
Yep.
like certain topics or words we're supposed to use. So
Okay. So a study drug. Okay.
study drug,
Okay.
yes. The study drug is a drug called RE-104. So it's a drug that is comparable or kind of similar to psilocybin, but it's a
Hmm.
synthetic version of that. So folks that are eligible to participate are individuals who have had some type of cancer diagnosis. They're also looking at recruiting other folks who are dealing with other kind of chronic illness related things too. I know that like MS is a qualifying
Oh, wow.
diagnosis.
Okay. Good to know.
ALS is also a qualifying diagnosis, among others.
Okay.
And if folks are accepted into the trial, they will get some type of dose of RE-104. They're either going to get a high dose or a low dose of RE-104.
Okay.
So they're looking to kind of see what the effects of this study drug are on folks who are dealing with these types of illnesses.
Okay.
It's really kind of interesting to be part of this. Like it's a learning curve for me because this is not my background. I
Hmm.
never went in the direction of research or academia or anything like that. So it's just been a really cool opportunity. And there's also other things on deck too. There's another study that's being done on microdosing of psilocybin
Hmm.
for folks who are using opiates for pain related to
Oh,
cancer.
wow. Okay.
And I believe there's also some stuff kind of coming on deck too for ketamine, possibly for caregiver burnout, which is like
Okay.
another piece of
Huge. Yeah. Yeah. So Roswell is doing the clinical trials with the other place. I can't remember the name. You just said it.
it. Yeah.
Reunion. Okay. So it's not necessarily cancer patients. Is this people post cancer treatment?
That's a good question. I think that somebody could be in active treatment. And I also think that for folks who may have had a cancer diagnosis at some point too, I don't remember off the top of my head
Okay.
what the exact time frame is of things.
Yeah. Yeah.
There's a psychedelic science initiative webpage as part of like Roswell's like
Okay. Great. Okay.
there's a little form on there. If folks are interested, they can kind of head over there and take a look. And there's a contact form on there as well where they can kind of reach out and talk to somebody who's doing some of the enrollment for those things.
Okay, great. Yeah, no, that's great because, people, again, want access to healing. They want access to this. They want this as an option. And I think because, again, the legality of things hasn't quite caught up, but
Mhm.
research is going to be a safe way for people to get involved with some of this stuff if they're interested in this modality of healing. Because, again, it's like particularly psilocybin is not legal yet in New York State. So this is a safe way to get involved and see if you qualify.
Yeah, and it's a great way. It's just really exciting that this is happening in Buffalo too, because you hear of these things
Huge.
happening in like big cities. You hear of this in New York, you hear of it in Los Angeles, and
Denver. Yeah.
right, yeah, and to kind of get Buffalo on the map, with some of this stuff is pretty exciting. So I'm really glad that Roswell is having this opportunity, and folks here locally will be able to partake in that.
Yeah. No, it's wonderful. I'm really hopeful about what this will look like going forward and what this will mean. I think that any therapist is going to benefit from going through this training, even if they're not actively sitting with clients who are journeying with ketamine specifically, because that's again what's legal right now in New York State. To understand, I have worked with folks who have had other therapists and have, oh, don't do that, or I don't know anything about that. And I'm very much like, well, is that person trained in this? They're giving their opinion, but are they trained in this? And do they understand what this looks like or what this can mean for a person in terms of their healing journey? So I'm always like a question asker. I don't like to just see one thing or hear about one thing and poo
Mhm.
poo. It's very much like, well, I need to know more about
Mhm.
that.
Mhm. Yeah, and that's such a I think about a few years ago I had an experience where I'd had somebody reach out to me and they were kind of like asking me a bit about psychedelics and they were kind of telling me about like why they weren't comfortable with them, and what I'd come to find out is that they had a family member who had died from a drug overdose. And I think about that all the time when I'm doing this work because I understand that people bring certain biases or they bring certain history in, right? And
Mm-hmm.
sometimes we have something so traumatic happen that we kind of like protect ourselves and we're like, I'm going to kind
Yeah.
of wean myself off from these things. And to your point, I think like having curiosity, learning more, it's such a powerful tool to understand something that we maybe don't otherwise understand.
Yeah.
So that's another place I'll tell people, like, I'm always willing to have conversations. One of my favorite things to do is to provide education and background information on these things and talk to people about how the applications of some of these things can be done safely and in a way that, is kind of keeping the integrity of the work. And yeah, for folks who are interested, I guess as clinicians and in exploring psychedelics in general, what I say to people is that if you're not talking about this in your practice yet, you probably will be in the next handful of years because
Yeah.
I really do have a strong belief and feeling and a kind of gut sense that this is going to be a big piece of
Hmm.
mental health treatment in the future.
Absolutely. Yeah.
And we're due for something new.
Yep. Yeah, I mean, our field has evolved so much, and
Mhm.
I think, with more research, again, this research isn't new either. I always like to tell people that
Yeah.
this was around. And then the war on drugs came in and people lost the ability to research and study the effects of what these things can do to help people.
Yeah, and even in addition to that too, we think about how historically people have also been arrested for doing things like this. So
Yes,
this is not just the war on drugs was disproportionately affecting people of color and people of backgrounds that, where there could be some skepticism of stepping into this space or
of course, yeah.
even thinking about like bringing in indigenous practices, cultures who have been using these
Mhm.
medicines for centuries.
Yeah.
Like,
Yeah,
they're
beginning of time, right?
yes, so much
We go
space for all
back.
of it. Yeah,
And if
totally.
we really wanna get into things, really looking into religious ceremonies and so forth, I mean, they all were including this stuff. They tend to omit that in the current release of
Mhm.
of of things, but,
Totally.
it's been around, right? And it's interesting. I mean, I always direct people to how to change your mind, whether they read the book or whether they watch the Netflix series, but it's a great intro, like you said, it piques your interest, and now it's like, "Okay, well, I wanna know more about this." You know, I'm here for it. It's great work. It really is.
Yeah, and if I could plug one more resource,
Yeah.
a newer thing on Netflix that I've been, kind of directing people toward is there's a documentary that came out the last maybe like a month ago now called "In Waves and War."
Ooh, I have not watched that one. Now I have to
Yeah,
add that to the list.
pretty cool. It's a story about combat veterans who were serving in the military post 9/11, and many of these individuals were Navy SEALs who had really significant PTSD and returning back home. And
Mhm.
their journey kind of takes them to treatment with ibogaine and 5-MeO-DMT in Mexico
Oh,
through a
wow.
organization called VETS, which actually sponsors these trips for these trips, literally and figuratively.
Yes.
For people have access to this or how these veterans have, and it's really kind of an interesting story to watch, or interesting to watch their story unfold. And I encourage you
Yeah.
to check it out.
And what's it called again?
In Waves and War.
Waves and War. Okay. Okay. Yeah. Awesome. Yeah. I think anything where people can watch it and they can hear accounts, because I'm assuming that's like a documentary where people
Yep.
are sharing their personal
Yep.
experience. It's not just like watching a movie and it's like real.
Oh, it's very
Um,
when you watch it.
Yeah, yeah, and I think of too when you think of trauma, you think of, well, you just mentioned Navy SEALs. I mean, this is the toughest. Like, it doesn't get more tough than this. Like,
Yeah.
these men, and I don't know that if women make it through or not, but the individuals who go through this
Mhm.
training, like, it's not like they're. I know I'm not surviving that. It's grueling.
Mhm. Yeah, these guys, it's all men in the
Okay,
documentary, from my recollection that have gone, through this process, but what you see is really interesting, and I won't give it away, but you see not only kind of the recalling of wartime stuff, but you also see this kind of go further back for some of these guys too when we're
of
talking about
course.
trauma. So it's really kind of an interesting story to watch and just kind of see how them engaging in some of the psychedelic treatment has really benefited them.
Yeah, no, I know you mentioned IFS, which IFS ties in a lot. I mean, that's the other thing about like doing psychedelic work. A lot of other modalities tie really well into it. Like, I love to do EMDR after a
Mhm.
client has done ketamine, not like in the same day, but like when they're done with their ketamine sessions, processing EMDR and like the ability to go deeper and really reflect and connect the dots is kind of cool. IFS, I'm assuming, is very similar. It's very interwoven in and better understanding the parts of self that helped them survive.
Definitely. Yeah. And I think like the psychedelics really, and you probably see this with EMDR too, is it sort of like lowers defenses for people. There's a lot
Yes.
more workability and a lot more access maybe to things that otherwise might be pretty protected.
Hmm.
So it's really kind of a very interesting time to work with people therapeutically in the days following, or the weeks following a psychedelic experience. It really kind of is a very fertile ground for a lot of growth and ability sometimes to move through things a little bit easier than we might otherwise be able to do.
Yeah, that introspection that I think sometimes is really hard, to take a look at. Yeah. No, it's great stuff. It really is. So, if somebody wanted to get a hold of you, how would they go about doing that? I know I will list this stuff in the description, but
Yeah, thank you for doing that. I would say there's a contact form on my webpage that has a little kind of inquiry box on it. That's a great way to get a hold of me. Email is also a really great way to get a hold of me. I'm kind of like those are the places that I feel like kind of help me kind of organize and
mhm.
keep things in a place. So either one of those things would be totally fine.
Okay.
And preferred. And if folks are interested too in kind of what we're doing with like, the Center for Healing Intelligence, we
Yep.
also have a web page for that. So if you wouldn't mind listing that, that would also be
Yes.
awesome.
Absolutely. That and, if there's a link to the training, I'm assuming that's
Yeah.
on at Chi as well, the website for
Yeah.
that. Okay.
I can get that over for you too.
Yes.
Yeah, I just want to say I really appreciate the work you're doing. And, obviously we've been colleagues for a really long time and
Mhm.
we've been in kind of each other's orbit in many different
Yeah.
ways. It's exciting to see what's happening for you and in your own work with psychedelics and also what you're doing here. Yeah.
Yeah, yeah, I wanna launch it, I know I've mentioned this before, but just the world I feel like has been on fire and
Mm.
it, like, hurts my heart. Like, I just want something that's good, that's helping people, and this was kind of where I came to, Tie it all in because we are the Unapologetic Midlife Podcast. How do you feel like psychedelic work can help us midlife?
Oh my gosh, I could talk. What I will say though, so I turned 40 this year and I
Okay.
people all the time, I feel like something like a switch flipped in my brain.
It's a fun time, isn't it?
Yeah, it's like, "Oh, I'm 40." I'm like, "Whoa, holy shit." Like that's what it felt like. And I feel like there's sort of a bit of a reckoning, that I feel like I've been doing. I feel like I've had these like milestones. Like I turned 40, I lost a parent this year,
Mhm.
like things that, are sort of like kind of really calling me to think about, what does it mean to be in midlife?
Yeah.
But I think again, like I said earlier, it's kind of a call to live more fully. I also think about, especially for us women, I've started to in the last, handful of months start to deal with some perimenopausal stuff.
Yep.
Feels weird to say out loud, but it's like it's happening.
You know what? Validate. You need to validate because you are not alone. If about 44, and if you kind of look, they say that, I used to think that we age slowly over time, but they
Mhm.
say there's like two kind of pivotal points where we tend to age eh, greater. And I know you're 40, so you're not quite there. Sorry to burst your bubble, but 44 and 60 are kind of like two pivotal ages. And
Mhm.
44 was about when, everything kind of started to go south for me. And it was like, okay, what is going on? And I can't do this anymore, right? Like I need to, get some help, seek some answers, better understand what is happening.
Mhm.
So, I've been launching that from the mountaintops.
Yeah, and it's so important the work you're doing around advocacy for that. And I would say, psychedelics could play into it in so many ways. Like, I think about exploring our mental health or our well-being with psychedelics in a way that allows us to really kind of be very present with where we are. I think it can help us gain better understanding or acceptance of certain things that are happening for
Hmm.
us.
Yeah.
I also think too, just sort of allowing us to have, a different way of looking at how we're handling transitions and how we're
Hmm.
dealing with things like maybe our own mortality,
Yep.
like these things that can come up. And like you said earlier about being a cancer survivor, I am too,
Yes. Yep.
like, dealing with that type of diagnosis at 30. I don't even think I really processed it at that time. Gosh,
Probably not. You're in survival mode. And then at some point you reflect back and are like, holy shit.
yeah. I look back and I'm like, whoa, I've done a
Yep.
lot. 40
You
years.
have.
Oh, yeah.
Yeah.
So,
Yeah.
so I think psychedelics could be all part of that larger equation. And I also would imagine too, and it will probably see this forthcoming, I hope, is even more research on things like psychedelics for applications to things like perimenopausal stuff or menopausal things,
Yeah.
transitions for men or women or whatever that looks like. And that's just really exciting to know that that's a possibility as well.
Yeah, I wouldn't be surprised if there's something because it
Mhm.
just all the research I'm starting to see now come out of what our lack of hormones is doing for our cardiovascular system, for cognitive decline. When you start to see that, I know there was a doctor that posted this past week about, this current research that was out and she's like in her like a pajama top and not in a bad way, but just like, she was like ready to roll. She's like up and at 'em and she's like getting this out to the world. She's not messing around. And it was great because she's very passionate about it. And it's hard to not like jump on that bandwagon, especially as you start to notice changes in yourself.
Mhm.
And I don't want the generations after us to suffer because we weren't prepared for this. I know the women in my life, the older women in my life did not prepare me for this. I only knew about hot flashes and I barely knew about that. So
Right.
there's
And
that.
and I think too, Mindy, like, you were saying earlier, when we kind of got into our little thing about death, which I'll say the word again.
Yep. Yep.
We've covered a lot of controversial topics in
We
this
have. That's
conversation today.
okay. Let's
Um,
have at it.
yeah, but you were talking a bit about what we leave behind, and I think about stuff like this, like the work that you're doing here in this podcast, or the work that we're doing in the therapeutic space. It's like that's part of the legacy, right? We're
Yes.
helping people or alongside people as they're rediscovering things about themselves and they're healing or they're finding answers or they're unlocking new doors, and that's a privilege and it's
Yes.
amazing work. And it's like your little contribution to leaving the world better than you found it, right? Is
Yep.
what you're doing, which is great.
Yep. Same to you. Same
Thank you.
to you. I feel like you feel a calling and I don't know, it kind of feels easy. I know I started this field of therapy going into this field later in life. I went back, to school at 28, finally got my head out of my butt to like actually finish that bachelor's degree.
Mhm.
And, then I was diagnosed with cancer and, went through that whole horrible year and still made it back to graduate school. It
Mhm.
made it more clear than ever what the path was.
Yeah.
And I always knew private practice was where I wanted to go. And then you had to, I don't want to say suffer through the clinic work, but as you know, it's tough working in the clinics. It's tough
Mhm.
work. So now I feel I've earned the fruits of the labor at this point, and you know, being able to direct how we're doing this is just it's such a great gift, and to be able to pay it forward to people is even greater.
Totally. We both have that Aries spirit too.
Oh my god, yeah. The fire is there. Yeah.
We'll find a path. We'll figure it out.
Yeah, resilience is an awesome thing, and if we can learn to tap into it, and we all have it, it's just remembering that it's there and it will help
Mm.
us get through whatever we're gonna face. We'll figure it out.
Yeah, I can't wait to listen.
Awesome. Well, thank you so much for re-recording this with me because I was definitely learning this still. But, I feel like today went really well. And I am excited to get this out and share this with people. They're going to be excited to hear about this.
Yeah, thank you for having me here and thank you to everybody who listens. And I hope, if nothing else, this is helpful or inspiring to someone somewhere along the way.
I hope the same. Thank you so much, Jenna. And I look forward to having you on again in the future.
Thanks, Mindy. Have
All
a
right.
good night.
You too.
Bye.
Bye.